to the following vector relationship with its concurrent disease. Okay, so now let us look into Aedes. This causes yellow fever, and the scientist who is related to this is Walter Reed. Anopheles, all of us know, causes malaria. And Ronald Ross, for which he was awarded the Nobel Prize. CC fly causes African sleeping sickness. And the scientist related to this is Bruce. Yes, not Bruce Wayne, Batman. Okay. So answer to this question was 3. Answer to this question was 3. Okay. Question number 2. Lockdown in Corona is which type of prevention? Yes? Now, let us first get the concept of prevention clear in our minds. See, WHO has got a very simple concept. WHO says, ask what it prevents. So, primordial will prevent, risk factor primary will prevent, disease secondary will prevent, complication tertiary may prevent further complication. Now, in case of corona, the risk factor is present. And that is the coronavirus. So the lockdown can't prevent the risk factor. So it is preventing the disease. And so lockdown is a typical example of primary prevention. Is a typical example of primary prevention. Question number 3. Better recall of exposure among the cases in a case control can result in. And this is typically a recall bias. This is a typical feature of case control study which occurs due to differential recall between cases and control, and this will lead to a measurement bias whose other name is information bias. Generally in NEET exam the tendency is to ask these synonyms. So let us know the WHO classification of biases. So there are 2 types of bias. One is a selection or susceptibility bias. The other is measurement or misclassification or information bias. In this case, we have wrong measurement of we have wrong measurement of exposure and disease. This occurs at time of data collection. This is of two types. One is recall bias and the other is interviewer bias. The name is very clear. In interviewer bias, it is the doctor who is making the error. Selection or susceptibility bias. Person selected is not representative of general population. This occurs at time of recruitment. And selection bias is of two types: volunteer bias and hospital-based or Bergsonian bias. The name is very clear. Volunteer bias, the patient is to blame. In hospital-based bias, it is the hospital which is to be blamed. Now, question number 4. If health policy makers want to evaluate the impact of prevention program, which is the most appropriate to be considered? The answer is incidence. Now, why? Classic definition. Prevention is better than cure. Now, preventive strategies. Preventive strategies. This will reduce incidence, and since this reduces incidence, it will also reduce the prevalence. Whereas in case of curative strategies, where there is 100% cure, there is reduction in prevalence only. And that is the reason to look into prevention, we have to look into incidence. Now, what is the basic difference between incidence and prevalence? Incidence tells about the new cases, whereas prevalence tells about the new plus old cases. Okay? Now, question number 5. If a researcher wishes to estimate the incidence of myocardial infarction among a group of workers using OCP pills followed for 10-year period, the researcher has to carry out cohort study. Now, what are the key words to recognize these study designs? In case of case series, it is abnormal findings. Like corona, initially when there was an outbreak, it was like a case series. Ecological study, when we take into account the population level estimates, it is ecological. Cross-sectional, it is snapshot study, that is at single point. for cohort study, follow-up is a very, very important word. Is a very, very important word. Now, question 6. More false positive on screening in a community signifies that. Now, there are many books which mark as sensitivity and specificity, which is wrong, because sensitivity and specificity are intrinsic properties of a test which are constant. Now, when the false positivity is more, the prevalence is less. So answer to this question is option number 1. And therefore, it is always advisable to perform screening tests in high-risk population where prevalence is more, where the prevalence is more. Okay, now this is solved in a conceptual manner. This can also be solved mathematically. Now imagine for a test the sensitivity is 0.9, the specificity is 0.9, prevalence 10%, prevalence 30%. So if I draw a 2 by 2 table, plus minus, gold standard screening test. Now total 100 people I assume. Since prevalence is 10%, so I write 10 plus 90. Here it will be 9, 1, 81, 9. If I draw a similar table with a prevalence of 30%, then 30 plus 17. So 90% of 30 is 27, 3. 90% of 70 is 63, 7. Now, as you can very clearly see, as the prevalence has gone up, the number of false positivity has come down. The prevalence is inversely proportional to number of false positivity. This is the second explanation to this particular question. Question number 7. 75% negative predictivity includes. Now, what is the definition of predictive values? Suppose I take PPV for definition, positive predictive value. If a person is found positive with a test, the probability that he has the disease, this will be called as PPV. Definition of sensitivity: ability of a test to tell those who have the disease. So, the moment we talk about probability, it is predictive value. Okay? So in this question they say 75% negative predictivity indicates there is 75% probability that the people tested negative for disease do not have the disease in reality. So answer to this question is option number 3. Okay? Now, Question number 8. MMR, the denominator for rate is, see, MMR can be maternal mortality ratio or it can be maternal mortality rate. The numerator is maternal mortality. Denominator for ratio, it is number of live births. Now what is a ratio? A ratio means there is a numerator, there is a denominator, and numerator is not part of denominator. What is rate? Number of females in reproductive age group. Number of females in reproductive age group in a given year. In a given year. Yes? So, number of live births. This will be for ratio. For rate, it is number of females in reproductive age group in a year. Now, dose of anti-tetanus toxin given to newborn of an unimmunized pregnant female is 750 international unit. Given within 6 hours of birth. This is given to completely unimmunized mothers who have not taken the TT vaccine or the DT vaccine. This is given to the children. Ideal number of AMC visits as per WHO is 14. The minimum number of visits as per WHO is 8. And the minimum number as per Government of India, it is 4. So AMC visits ideal, minimum. Ideal is 14. Minimum. Government of India 4. WHO 8. How is it 4? First visit less than 12 weeks. This is called as early registration. Second visit 14 to 26 weeks. Third visit 28 to 34 weeks. Fourth visit after 36 weeks. Now ideally, one visit per month till 7th month. This is 7. One visit every 15 days in 8th month. 2. One visit per week in 9 months. 4. So total there are 13 visits. The pregnancy, it is 9 months and 7 days. For this extra 7 days, one more visit. So total, ideally there should be 14 visits which a female has to do. Question number 11. India Newborn Action Plan, the target NMR for the year 2030. Now, the objective of INAP is to reduce the neonatal mortality rate and stillbirth rate to less than 10 by 2030. So answer to this question is option number 1. Answer to this question is option number 1. Yes? Okay. Question number 12. Which of the following is correctly matched as per the categorization of states under the National Framework for Malaria Elimination 2016 to 2030? Yes? Category 1. States with API of 1 per 1000 and above. Category 1 basically refers to those states where the API is less than 1 per 1000. Category 2. States including all districts with API of less than 1 per 1000 with some exceptions. Seems to be the correct answer. Category 3. API of more than 1 per 1000. The best answer to this question was option number 2. Option number 2. So, we now have the National Framework for Malaria Elimination in India 2016 to 2030. There is no more rollback malaria. This is no more existent. Okay? Now,